I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be doing good. So today we are going to talk about something which is really important, and almost all of us, or at least most of us, had gone through this phase. Now, first of all, let's talk about the month, the ongoing month, which is June. So June is just not another month like January, February, but it is even more important because this month is considered as Acne Management, Acne Awareness Month, which is dedicated to shedding light on a condition that affects millions worldwide. Acne is just not about a problem which is on our surface, on our skin. It's way deep down because it affects our emotional quotient, it affects our self-confidence, etc., etc. So we need to talk about acne and talk about its holistic treatment approach. Acne vulgaris is a very common chronic condition affecting more than 85% of adolescents and young adults. Yet despite its prevalence, there are still widespread misconceptions and stigmas surrounding it. So it's very important that we understand what is acne, why acne happens, what are the main causes, and how to manage acne. So we are here to talk more about acne and its management. So acne management is our topic today, and for that we are going. So before we begin the session and the doctor joins us, let me tell you something about our skin experts of today. So today we are honored to introduce to you Dr. Priyali Shah, who is going to join very soon. She's a renowned skin expert hailing from Ahmedabad. Dr. Priyali Shah, distinguished consultant dermatologist and cosmetologist with a passion for holistic approach, holistic healthcare. Armed with an MBBS and DVD, Dr. Shah brings a wealth of expertise to her practice, prioritizing personalized care and comprehensive treatment plan with a genuine concern for her patients' well-being. Dr. Shah and her dedicated staff ensure comfort and prompt attention at every visit. What sets Dr. Shah apart is her commitment to a holistic approach where skincare and hair care aren't just about medications, but a collaborating journey that includes you, your diet, your lifestyle, everything, and your preferences as well. So by involving patients in the process, Dr. Shah believes in making skincare and hair care not only effective, but also empowering and positive experiences. So here is our guest today, Dr. Priyali Shah. Very warm welcome to you, Dr. Shah.
Thank you. Thank you. Very nice to be here.
It's such a pleasure to have you to host you today, doctor, because as we all know, June is also dedicated to Acne Awareness Month. So it's equally important to know and understand what is acne, what are the root causes, etc., etc., and most importantly, the management approach, because most of us, goes through that phase of acne vulgaries. And
Yes.
with you, I'm sure we are going to have a very, very informative session today. So again, a very warm welcome to you, doctor. And to begin with, what is acne, doctor?
So there are lots of words which are used for acne. So pimples, zits, that is all for acne. Acne is basically when the follicle where your hair grows, that gets blocked with oil, dirt, dead skin, and then it is clogged. So now you have an acne or a pimple on your face. There are multiple types of acne that can happen.
Mm-hmm.
So you can have just tiny bumps, which are also known as papules. Then there are the kind where there is going to be pus inside. So now that is a pustule. And then there are the kind which are really deep in your skin. They're really painful. They are red. They look angry. Now those would be cystic acne.
Okay. So at least now we know what is acne and what are the various types of acne. Many times we see doctor, we see acne on our forehead, tiny tiny bumps. Then we see
Hmm.
acne in the butterfly area, cheek, nose, and then we see acne alongside our jawline.
Right.
Do these specific areas where these acnes are taking place, they tell us something, they symbolize us something?
they symbolize a lot. So even as soon as you walk into your dermat's clinic, even before you started talking, they already know what's going on all over because of
Oh.
the location of the pimples.
Uh-huh.
So if the location is around your forehead, so which is close to your hairline, then it's on the sides of your face, then it is usually going to be happening because of dandruff on your scalp. Very often, pimples will also show up on your chest, on your arms, or on your back. That again is going to be happening because of seborrhea, seborrheic dermatitis, or dandruff, which is a fungal growth happening on your scalp. So, which is why the forehead bumps, they are not usually so painful, but they can be itchy sometimes because they are happening because of dandruff and fungal growth happening in your skin. The other locations would be the front of the cheeks. This area is very characteristic for teenage acne. So, school going kids, 12 to 17 years of age, are usually going to have acne over here. Around the jawline is a very standard location for hormone imbalance induced acne. So, patients who have polycystic ovary syndrome, those kind of hormonal imbalances will show up acne over here. Patients who've just recently started oral contraceptives will also show up with acne around their jawline. So, based on where you have pimples, we will know what's going on inside the body.
And what are the main causes, doctor? Why acne happens?
So, between the ages of 12 to 22, they are happening because of the hormonal changes that are happening in the body, because of adolescence, oil gland activity is going to start activating in your skin. So, those acne here are just happening because of the age that you are in. So, at that point, we don't really want to disturb the growth of the person, but we just want to make sure that the pimples don't really damage your skin too much. Right? Now, if the acne is happening on your forehead or on the side of your face or on your back, chest, arms, these are very easily manageable because it is associated with your scalp. So, as soon as we can figure out what the correct anti-dandruff treatment would be for the patient, these acne can be managed very easily. Hormonal pimples which happen down here, or stress-induced pimple which happen here, or there is also a variant where there is diffuse random pimples are happening everywhere. That can also happen because of barrier disruption in the skin. If you've been trying too many things,
Mhm.
too many serums and too many face washes, then it'll be all over. So figuring out what is the root cause will be our first step in treating that problem.
Right. So diagnosing or finding out what is causing acne is from where the doctor
Most
starts,
important.
you know,
It's most
and
important.
depending on that, the treatment depends.
Yes. So
Okay.
if I have two 15-year-old girls, even if they've come with a similar presentation of acne, their root cause might be different, so their treatment will be different. So it is not like one treatment will fit all.
Right, right. The very common tendency that's prevailing in our society, especially in case of acne, we often do is go for home remedies, you know, apply something, quick
Hmm.
fixes. We have so
Yeah.
many influencers these days on various social media platforms who have these quick fixes for almost everything, especially things related with our skin. And that is something we love doing. So whenever we get an acne, rather than going to a doctor, we'll love doing or applying something on on our skin. Now, doctor, do they work? Because many times I've seen people, they keep on trying, trying, trying after months of their trials and failures. When they go and land in front of a doctor, that's
Hmm.
when the doctor tells that in case you were here, you know, 3, 4 months back, it was easier to treat you. So, do
Yes.
these home remedies work?
These home remedies worked 50 years ago when we didn't have better options. When it was not important that how is your skin going to look after the side effects of the home remedy, as long as the root problem has been targeted, it was fine. Now when we
Right.
have better options, why is how is it okay to put food on our face or put toothpaste on our face? Or I have had patients who have put apple cider vinegar, they've
Mm.
put garlic, they've put ginger, they've put tuna, they've put anything that is available instead of really well tested, documented, studied things which certified people are offering to you. So then there is just so much correction that has to go, because now we are not just dealing with the pimple, but we're also dealing with the chemical burn that has happened. We're also dealing with the pigmentation that has happened. We're also dealing with so many other things. And because that patient has already tried so much, their psychological profile is also so upset and all the motivation is gone. It's just much harder
I
to
think
deal
we
with
have
it.
an obsession for natural things. You know, a very common phrase that people often use is कि doctor के पास जाएंगे तो वो तो chemical देंगे. We don't understand that whatever we are applying is also a chemical. You know,
Everything
turmeric
is chemical.
chemical.
Water is H2O. Everything is
Right,
chemical.
right.
So
So
that
I think we
it's
need to understand that.
basically, yeah, figuring out what is the right quantity, right percentage, and everything, which is what the doctors and pharmaceutical companies have already done for you, so that you don't experiment on yourself.
Another very common tendency, and I'm sure you also get lots of patients with that, is to go for over the counter topical applications. You know, if home remedy is not working for 2 3 days, we'll end up going for a chemist shop. कि भैया
Yeah,
कुछ पिंपल हो गया है कुछ दे दीजिए, and we'll keep on applying it. So and I'm sure you also get patients, who have done the
that
same.
is a very good point that you brought up because what does the chemist want? The chemist wants that you should come back and you should refer other people also that, inke paas gaye the, it was fine, it really helped me. So they are going to give you a quick fix. A quick fix is usually a steroid. So now you are applying undiluted, unprescribed steroid on your face, which will give you a very quick response, but then it's going to leave you with five other side effects because of it, which is why over the counter is not something which is recommended for anything. Usually patients will be given steroids.
And initially, because steroids, as you said, works wonderfully. ऐसा लगता है कि हाथ में हमारी कोई magic cream लग गया है.
Yeah.
And then we get addicted to that, cream. Over a period of time, when we realizes जिस दिन नहीं लगाया उसी दिन pimple आ गया या जब थोड़ा सा ऊपर नीचे हो रहा है, then our face is getting
Skin
really
breakthrough
bad.
will happen, skin is going to become really thin. You're going to start getting hair growth on the face. Then there is patchy pigmentation that can happen because of steroid. There's just a lot of things. Barrier gets completely disrupted. I've had a few patients of that kind, and it is a lot of work to remove their skin from that steroid addiction because it is an addiction. So then there is going to be withdrawal symptoms also. So there is a lot of counseling that has to happen uske saath ki, this is going to be a long journey, but it will be worth it. Please don't buy that tube again.
Right. So if a person comes to you immediately after, having acne, and a
Hmm.
person who had gone through, the home remedies, over-the-counter medications, creams, etc., their treatment time differs. I'm sure
A lot,
the one who's
a
coming
lot.
after a long time is taking a long.
Yes, yes. So there are a few patients who have done the experimentation and then they've gone through the whole correction period, which can sometimes be up to 6 months also. And then they have a younger brother or sister who's just 11, 12 years old and they will bring them. Can you please start early on? Give them the right face wash, give them the right shampoo so they don't have to go through what we've gone through. So if the patient is coming at the very beginning, or they are just coming for basic skincare because it is common knowledge that school mein other people are getting pimples, so it's probable that I will also get it. So they're just coming for basic skincare. Then we can manage their pimples without any medications, without any tubes and anything that they have to do. Just basic face wash, moisturizer, sunscreen, and it's taken care of. So it is good on your, I don't know, self-esteem. It is good on your pocket. It makes a lot of difference.
Another, trend these days are of the influencers and following them blindly, and either they'll, give you some home remedies, or because they are also earning,
Hmm.
by being an influencer, so they are endorsing a lot of products. And nowadays,
Hmm.
people are buying so many in the name of routine skincare. We
Hmm.
end up buying like 50 bottles, and we'll keep on changing them.
Yeah.
Is this behavioral change also increasing the cases of acne?
Definitely, definitely. I have had a few patients who will have a very bad barrier, disrupted barrier. So if they don't use these seven products, their skin starts to burn, their skin starts to sting. And then once we go deeper into where did you get this entire list of regimen, I am following so and so influencer where they are doing so many steps because they want to include Korean skincare and then they want to have the glass skin and they want all of those things and they want to do retinols. So I have like 17, 18-year-old patients who are doing retinols unbeknownst for no reason, because the influencer has said so. The influencer can definitely help if, for example, you have a certain body shape and you don't know what kind of clothes to buy. You figure out, okay, this influencer has a similar body shape. What is she wearing? Maybe I can wear the same thing. Now, this is a great thing because you're going to, this is something tried and tested and it's going to work for you. But that doesn't apply to skincare, because how do you know what skin she has? You can't see it. They can't see your skin. So I think there it's up to the patient or the person to use their best judgment, and how much do I want to spend on this, how much do I want to experiment on myself, and how long it will take for my doctor to correct all of these things.
Right. And we all are different. I mean, we have different skins, we have different skin problems, we have different root causes for those problems. So it's important to diagnose.
Hmm.
So if you are following an influencer going by what the chemist is asking you to apply or take, they are not diagnosing your problem. They are not going inside the root cause. So that's why it's even more important to go and consult the right person, which is a qualified dermat.
Because it
Now,
might give so much information about other things also, right? Based on the location of the pimples, very often we'll end up diagnosing a hormonal imbalance that
right,
had gone undiagnosed.
right.
So the patient will have hair fall also, they'll have weight gain also, they'll have mood swings, they'll have depression, but they don't know that all of these are happening because of one cause.
Correct. You also mentioned somewhere, doctor, that maintaining a good skin care routine is important. You
Hmm.
yourself have such a flawless skin. I mean, have you ever encountered acne in your life or not?
A lot. My nickname in school was Pimples. I got pimples the first in my class. So I bring a lot of my personal experience into how I'm treating my patients.
Uh-huh.
So at that point, we didn't have so many options. And that time it was believed that you're getting pimples because your face is not clean. So
Right.
my parents would repeatedly tell me, go wash your face, go wash your face. And my face would be paining. It would be so horrible. So now we know better. We know that don't wash your face more than twice a day. Don't really experiment. You don't have to do things. But I had a horrible journey with pimples. Thankfully, I didn't get any scars and marks and all. I could treat as I had more education. But I treated my pimples after I turned 22 or something, after I went to medical college. Before that, it was not really so nice.
So, how important role does a routine skin care, thing do to your skin, or goes does it really goes a long way in maintaining a good, healthier skin?
Yeah, definitely, definitely. So if you have figured out what your skin type is, right? So if, for example, you have an oily skin, so you know that my main struggle is that my oil production is high. So if your face wash, if your moisturizer, if your sunscreen are made for your skin type, your oil production is never going to get converted to pimples, because there is nothing that is going to clog your pores. Everything that you pick up will be non-comedogenic. So the skincare routine is not just a treatment; it is also a major preventive factor. Then, if your skincare routine can take care of your face, just face wash, moisturizer, sunscreen, some night treatment, spot treatment that you're doing, if that can target everything, you will have to take there'll be so many, there'll be so few oral medications that you are doing. There'll be so few spot treatments and gels and all of those things that you will have to do, because just the face wash can take care of those things.
Okay. So,
Hmm.
cleanser, moisturizer, sunscreen, and in case you are having
Some
any
night,
treatment or
some night
exercise.
cream, yeah, to
Yeah.
target whatever is your main issue of that day.
Hmm. Now, with moisturizer, because people who are prone to acne, who have acne-prone skin or oily skin, they feel that I'm already producing so much of oil. Do I really need moisturizer? So, what's your take on that?
So the human body works basically by stimulation and response. Okay. So if I have one muscle in my arm and I'm repeatedly using that muscle, the size of that muscle is going to become bigger. Same way, if I'm washing my face and stripping all the oil off, the message that is getting conveyed to my oil glands is all the oil has been washed off, make more. So it is constantly being stimulated to make more. And after a point, you're like, my face is so sticky. I washed my face within 10 minutes, the face is sticky. But you only taught your skin to do that.
Hmm.
If you start moisturizing the right moisturizer at the right time, slowly, slowly, the message your skin is going to get is that I don't need to make more oil. It's already been moisturized. And the oil gland activity will actually go down. Oil gland activity goes down, size of the oil glands go down, and tendency of getting pimples will also go down just by
Okay. So
moisturizer. Yes.
it works like that. And
Hmm.
of course, with the cleanser, because you also said, you used to wash your skin a number of times, and that is a thing that people have in their mind. Ki chehra saaf nahi hai. So I need to, keep on washing my face, or I'm, producing so much of oil, I need to get rid of the excess oil, so I'll keep on washing my face. And you
Yes.
said it's not a good idea. So what is the ideal thing to do?
It is the same thing here. If I'm repeatedly washing my face, again, my oil gland activity is going to be higher. Along with that, I'm going to strip off all the healthy layer of oil that my skin needs to maintain its barrier. So infection potential also goes up. So what ideally I like to recommend is that wash your face twice a day. सुबह में नहाने के time and at night once you're home for the day. If at all you're going to the gym or if you're outdoors a lot, preferably just wipe your face with a dry napkin and reapply your sunscreen if you need to. But if you do wash your face in the afternoon, you have to do your entire regimen again. You have to moisturize again. You have to apply your sunscreen again. Just splashing water on your face does not help. We don't use plain water to wash anything, clothes, vessels, anything. So why apply it on the face?
Right, absolutely. And then sunscreen, with sunscreen also people have so many questions, complaints, excuses for not using sunscreen on a regular basis.
Hmm.
Like, I don't like the feel of sunscreen. I don't like the white cast it forms, or it makes my skin very dull, patchy. It makes me sweat a lot, etc., etc.
It,
So
it
what's your
needs
take? Why
so
it's
many
important?
excuses. So many excuses not to use sunscreen, and then I have to counsel the patient why you need to use the sunscreen. See, if you are using the right quantity, which is ideally, I recommend three finger lengths, face, neck, ears, everything that is open should be covered. So I say three finger lengths, right? If you're using the right quantity, no sunscreen bottle is going to last you more than 20-25 days. So in 20-25 days, if you don't like that sunscreen, try something else. Try different ones based on the few things which we want to follow. So we want something which says it is non-comedogenic. We want a broad spectrum. We want a PA3 plus. We want an SPF 50. Those are the few things which we want to read on top of the bottle.
Mhm.
ठीक है. Once that is there, if you don't like one finish, try a different finish. Each time try a different one and you will find something that you really love to use. You look forward to using. So like today I have used a tinted sunscreen. I like using a tinted sunscreen because it gives me like a makeup finish without having to do makeup. So this
Right.
fits my schedule, it fits my criteria. So trial and error will give you something which you really look forward to using because sun damage is not reversible. Tanning is reversible, pigmentation is reversible, but the collagen damage that happens to your skin is not reversible. So it is not worth any excuse to get more wrinkles just because I didn't like the finish of the sunscreen.
Many dermats say, I'm sure you'll also agree to it, that sunscreen also works as an anti-aging cream. So is
Yeah,
that
yeah,
true?
definitely, because I'm protecting my collagen. By applying sunscreen, I'm protecting the building blocks of my skin. If I'm not applying sunscreen, the collagen is going to break down, and then I'm going to do retinols. I'm going to feel the need to do Botox. I'm going to feel the need to do threads or fillers to reverse all that damage, which
Right.
is reasonable, which is cheaper, which is less invasive. Sunscreen is always a better option.
Okay, but then with so many sunscreens and then so many things written on the tube or on the box containing the sunscreen, as you said, these are the basics to go for. But then
Hmm.
people who are working from home, people who are working in very controlled, AC environments, or not going out much, don't
Hmm.
have much of sun exposure, or it's not sunny outside, windy, cloudy, whatever, hazy, do they
Hmm.
also need to apply sunscreen on a regular basis?
Yes. So the question I like to ask a patient is that if you don't turn on the lights at home in the morning, can you still see everything? You can still see everything. So where is that light coming from? That is sunlight because you didn't turn the lights on. Another thing is that UV radiation can cross your curtains. It can cross the clouds. It can cross everything. So if that is getting into your house, you need to have sunscreen on, provided you want to protect your skin from sun damage. Just because you're not stepping out of the house doesn't mean the sun is not coming inside your house. Another
True.
thing for people who work from home, they have a lot of screen time. Screen time is also going to act just like a sun. It also
Okay.
has blue light, it also has visible light, it also has radiation. So you still want to apply a sunscreen. Based on your day, you can always choose which sunscreen is right for me. So if I'm
Hmm.
just, for example, if I'm sitting at home, I have no screen time and anything, I don't need a sunscreen which has blue light and infrared filters, and I don't need all of those things. I don't need a water resistant sunscreen. I don't need all of those things. So based on what is your day, you can pick and choose, but
Right.
always
And
apply sunscreen, even if you are indoors.
and definitely, in case of doubt, you can go and consult a dermat who can help you in finding the right kind of sunscreen as per your skin type, as per your skin condition problems, and your routine, your work culture, etc.
And
Now,
the finish that you like. A good dermat
yeah,
will also be able to help you with what finish you like. Just because you have a dry
absolutely.
skin and you should have a moisturizing one, but you want a matte finish, then it's my
Hmm.
job to figure out which is the right sunscreen for you.
Right. So go to a dermat in case of doubt. They'll end up, they'll help you in finding the right kind of sunscreen, but apply it regularly, religiously. That's very important. So, Doctor, when
Yes.
a person comes to you with acne, are there any tests that you recommend to diagnose the cause, or you can just clinically figure out, what's the cause?
More often than not, clinical examination gives us all the answers. In very rare
Mm.
cases, if it's like, that we've tried everything and then we still can't figure out, then we find that blood test will show that there is a hormonal imbalance that is happening. But that is very rarely that we feel the need that, we need to investigate what is the root cause, because any kind of acne will come with other signs also. So if you
Mm.
have, for example, if you have dandruff-induced acne, you will also complain that my scalp is itchy, or I'm losing hair fall when I'm losing hair when I'm shampooing, or my scalp
Mm.
is becoming oily very quickly after I shampoo my hair. So there is always corroborating evidence that what is the root cause behind this. So blood tests can be done, but they're not always required.
Absolutely right. And then, what are the treatment options available, Doctor?
Based on the root cause, my first go-to is always to target which is the root cause. So, if for example it is dandruff associated, then I'm going to give my patient a proper face wash, a moisturizer, a sunscreen, and an anti-dandruff treatment. If they also have some pigmentation associated with it, then I will try to include a face wash, which will also target the pigmentation, or give them a night cream. If the pimples are happening because of teenage, then there is also a little bit of pain involved. They will have pus happening in the skin. So at times we need to use oral antibiotics also, because that is going to break the cycle. Otherwise, it will be like I get one pimple, it settles, then I get another one, and then there is this whole so many marks which are remaining on the face. So oral antibiotics are something that we like to use.
Uh-huh.
If it is a hormonal associated, hormone imbalance associated pimple, then either a treatment for that hormonal cause that helps a lot. That is the first thing that we want to target, because that is where the root is. Along with that, supportive skincare for sure. These are
Okay.
all the things that you are going to be doing at home.
Hmm.
Now, what else can we do is treatments which we do in the clinic. So then there are chemical peels and lasers which can also be done. So if a patient is looking for a slightly faster response, or they are not able to find time in their day to do everything which is recommended by the doctor, or there are some patients who don't like to take oral antibiotics at all. They are not okay taking putting tablets in their mouth. So
Hmm.
in those cases, we recommend doing treatments in the clinic. So our end goal is reached around the same time, that okay, in 2 months you start seeing noticeable results.
Okay. And as we also spoke before that, treating acne is one thing, treating acne marks or scars is another. So, what are the preventive, strategy that we can adopt so that we don't get those marks or scars?
Okay, so first of all, marks are usually a good thing. It is an indication from your body that you got hurt over here. So it can be because you fell down, you hurt your knee, you had a surgery, a mosquito bite, a pimple. That mark should be there, but not for a long amount of time, right? So if a mark is staying on your skin for longer than 6 to 8 weeks, then we want to start targeting that mark. Before that, that little brown pigmentation is just protecting the lower level of the skin, because it is healing itself. Okay. So a sunscreen is going to be the first step to prevent that mark from lasting longer than 6 to 8 weeks. because that constant sun exposure, constant UV exposure is going to make that mark stay there for longer. So if you get one pimple, but you've got like 15 marks, that is that means you're not using the right sunscreen or you're not using the right quantity. Okay.
Right.
Uh, Along with that, as far as scars are concerned, scars will they usually have a genetic predisposition or they're going to be dependent on your skin type. So there'll be two patients who get the same kind of marks, but both of them can will not necessarily get scars. Scars are the texture. So if
Mm.
there is a pit or there is a dip in your skin, that is a scar. And if the color is different, that is a mark. Scar will always do better again if you're doing sunscreen perfectly and if you're getting a faster treatment. So before your pimple goes from grade 1 to grade 2 to grade 3, try to get a treatment faster so that scar is not something that you have to deal with later.
Right. So sunscreen is important, plays an important role in here as well.
Yes,
And with,
for
of
sure.
course, with procedures, as you explained, you can do chemical peeling, etc. So for all the procedures that are done in the clinic, for that, the maintenance therapy also you give sunscreen as an important
Yeah,
thing.
sunscreen is something it's so I will not probably have had water today, but I've definitely applied my sunscreen. Sunscreen is most important for me. But maintenance therapy is usually just a basic skincare to target ongoing concerns. So if I have a kind of job where I'm going to be traveling a lot, then I'm going to get tanned very easily. So my face wash will be with a mild exfoliant that is going to target my pigmentation on a daily basis. My moisturizer will be by my skin tap, and my skin sunscreen will be a broad spectrum one, which will prevent the pigmentation from getting worse. So that way, based on whatever is your ongoing concern after your treatment is over, that kind of skincare regimen is what I like to give as a maintenance therapy.
Fair enough. We have so many questions from our viewers. I'll try to take them one by one. So Meenal is here. Her question is, how does stress affect acne?
Okay. Hi, Minal. That's an important question. I do tend to stress in my patients a lot as far as skin is concerned. Stress usually shows up with pimples around the mouth. That is something which I've noticed that if somebody is struggling with mental health or they have some emotional issues or they have stress at work, they end up getting pimples around the mouth. So stress is going to be disturbing your hormones. It tends to release more stress hormones in the body, which is going to disturb your normal estrogen production in your bloodstream. That is how it will give you more pimples. So one of the things I like to tell my patients is if I see any signs of stress, I ask them, how do you de-stress on a daily basis? So de-stressing is four things. Something you do for 20 to 40 minutes every day, something that gives you joy, something where there is no other person or screen involved, and it benefits only you. So if you can figure out something that you can do for 20 to 40 minutes every day, it will show up on your skin over time.
And many times we see that people say that don't drink milk or dairy products if you have acne, or don't go for
Yeah.
chocolates or etc etc. So how
Correct.
important is this diet plays, and what to include and what to exclude from our curries?
Okay. So oil does not cause more pimples. Spices
Mm.
don't cause more pimples, which is normally what people assume ki, I'm having fried food, I'm having tikha food, which is why garmi is showing up on my face. That is not the case. Food may dairy, sugar, and processed food. These three things definitely show up as pimples around this area, lower part of your face, for sure. For good skin, what I would recommend is that you don't have to go for all the supplements that are available. You don't have to go for all the powders and all the drinks. Basically, try to have a very well balanced diet. And more than that, antioxidants play a very strong role for your skin. So, antioxidants come from multicolored food. So if you're on your plate, you've got red, some blue, some yellow, some purple. So if you've got you've got tomatoes and different types of capsicum. You've got blueberries, you've got brinjal. Now you've got all the different colors.
Mm.
So something which I tend to tell my patients is that eat the rainbow. If you're eating all the colors of the rainbow, your skin is going to definitely be able to fight sun damage and is going to be able to fight oxidative damage. So
Mm. Right.
white, which is
So,
dairy and sugar, is not
intercolorful,
something. Yeah,
but
white is
that color should
not
be
part of the
natural.
rainbow.
Yeah. So Mohit is here, and his question is acne contagious?
Not really. No, no, no. It's not. It's not even contagious to your different body parts. So if you've
Hmm.
got a pimple here, you're not going to get another pimple on your chin or anything because of it. Only thing is that if you have somebody in your family who's got dandruff, and then you end up sharing their towel, you end up sharing their hairbrush. Those are things which you should be avoiding because, fungus.
Hmm.
That part of it
Okay.
is contagious, not more than that. Another thing is a major thing to prevent contagious aspect of pimples is not to burst your pimples, which is
Yeah.
something a lot of, even I have done it. My mom actually had a song to sing every time I used to go into the bathroom to burst my pimples. Something very hard to fight because
I
it's
know.
human nature. If I'm playing with something and there is something rough, I'm going to keep playing with it. That's just how human nature works.
We can't
So to
keep
prevent
our fingers away from our acne, our pimples. That's one of the biggest problems. How to do that?
Yeah. So what I like to recommend in that is using pimple patches. Whether the
Okay.
pimple patch is going to work in removing that pimple in 2 days, which it can, provided you're using it correctly. For me, a pimple patch is going to work so well because once I've put the pimple patch, I can't burst that pimple anymore. That
Right.
is a very simple solution if you have a tendency of picking on your pimples. Another thing with pimple patches is that if you're using it at the right time, it will prevent the pus formation, it will protect the surrounding skin also, and it will prevent your skin from getting a mark or a scar over there. Because that's what a pimple patch is supposed to do. It's going to suck all the moisture out, so your pimple will develop much faster and your skin is protected. So a pimple
Right.
patch works wonderfully if you have a habit of picking on your pimples.
At least it will keep your hands away from your
You
pimple
can keep
because the
touching it,
patch
but
is
it
there.
doesn't matter. You can play with the patch, it's fine. And removing
Right.
the patch is also very, see, bursting a pimple is satisfying because the thing is going to pop. So removing
Hmm.
a pimple patch is also very satisfying because you're going to be able to see evidence of that pimple in that patch.
That's true. That's true. Suvir is here, and his question is: what factor can worsen acne?
What factor can worsen acne?
Hmm.
Ah, so oil application on the scalp.
Okay.
Oil application
Okay.
is going to worsen your acne a lot, which is
Uh-huh.
something which most people just assume that this is good for us, so we should be doing it. So if you have dandruff, if you have pimples on your forehead, pimples anywhere on your face, on your body, oiling is something which you should put away on the side. That is the first thing. Another is
Okay.
going to be sugar, dairy, and processed food that we talked about. That is also going to worsen your acne. Picking on
Right.
the pimple, repeatedly washing your face is going to make the acne worse. Using expired products or using makeup brushes that haven't been washed in a long time. All of these things are going to make the acne. If you've got acne, then you want to follow 5 to 10 simple steps and don't waver from it at all. Those steps
Right.
your dermatologist will always be able to give you that, no oil application, don't wet your head every day, change your pillow cover every time that you wash your hair. These are basic rules which are always helpful.
Okay. And Doctor, before we sum up the whole session, any take-home message for our viewers?
Uh, Acne is a part of life. Everybody is going to get them from 12 years to 22 years of age. A good skincare will definitely prevent pimple marks, pimple scars, and it having, a lot of influence on your self-esteem. But other than that, it is nothing bigger than that. If you're able to take care of it, if it bothers you, you can always manage it, reach out to somebody who's qualified instead of experimenting. But it is again part of life. I have so many interesting stories because I had pimples when I was in school. So it is not the end of anything. It can always be managed, but it's fine. It's part of life.
Right. Thank you so very much, Dr. Priyali. It was wonderful talking to you, and thank you for making this session a very informative and very interesting one. Thank you so very
Thank
much.
you. Thank you. Thank you.
And viewers, thank you for joining us. Stay with us, stay connected, and keep following us on various pages. Stay happy, stay healthy, stay spotless. Goodbye. Have a great day.